Hello, my name is Dr. Julie Moreno, and I am assistant teaching faculty at Wayne State University's graduate programs in counseling and art therapy. I'd like to thank you for being here to gain some insight related to research on how to incorporate self-care practice into graduate counseling education curricula in order to instill a motivating lifelong practice for counselors in training. During my years teaching and practicing, I have recognized within students, supervisees, clients, and myself that if you are an empathic person, you give your all to everyone instead of recognizing and cherishing the most important relationship, the one with yourself. To end this introductory slide and to basically summarize this research with a short quote, Alan Watts from A Way of Zen succinctly states that art is a way of emptying the mind and centering the self. Our agenda will be to define burnout, to review self-care, and look at how to prevent and promote career longevity in mental health counseling. Any relevant research will be covered on expressive arts therapy in a self-care practice. We'll also be defining the roles of expressive arts therapy, life enrichment, and student-centered learning models in this research, while providing examples of how to introduce self-care into curriculum. Following Lisa Hines' insights in her 2019 book entitled The Life Enrichment Model, A Pathway to Optimal Health, I base this research on her idea of looking beyond a self-care practice to prevent a negative situation or achieving a safe, neutral state, but to understand how a self-care practice can lead to an enriched life and a sense of well-being, and in turn, how this practice can be introduced into and throughout counseling graduate curriculum. I approach this topic with an epic bracketed research lens to put aside my preconceived ideas of how to manage burnout and devise a self-care practice. Synergy has led this process, and I would like to express my extreme gratitude to Christopher and Catherine Carbone of Salve Regina University's Expressive Arts program for facilitating my exploration into the value of expressive arts to access, release, and transform. Burnout as a psychological syndrome is characterized by emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. Clinical mental health counselors who work with trauma are also exposed to additional risks known as secondary victimization or vicarious trauma. Vicarious trauma has been recognized as a distinct occupational hazard for mental health professionals and has been shown to cause therapist impairment that affects the therapeutic work and in turn can put clients at risk. Research has shown that practitioner burnout is not always reconciled through reactive interventions, indicating that preventive measures are the best option. In other words, lacking a self-care practice can contribute to higher levels of burnout and secondary or vicarious trauma stress symptoms and lower quality well-being. As shown on this slide, some of the symptomology of burnout in the form of compassion fatigue include emotional numbness, a feeling of disconnectedness from clients, difficulty concentrating, irritability, and decreased career satisfaction. Recent news headlines describe a mental health provider shortage in the United States. This fact alone emphasizes the importance of nurturing career sustainability for clinical mental health counselors. In 2024, the National Council for Mental Wellbeing stated that 9 out of 10 behavioral health providers have experienced burnout and half have considered leaving the profession. As of July 2023, according to the Health Resources and Services Administration, nearly half of the U.S. population live in health professional shortage areas. Difficulty with this retention, it begins at the education and training level, as indicated by the analysis of national graduation and licensure data. Approximately 57% of master's level graduates in mental health fields do not attain full licensure after graduation, and burnout is one of the most cited barriers to obtaining licensure. So burnout, combined with the knowledge that mental health care providers have an increased risk for suicide due to the nature of the work, indicates the critical need for including self-care practice methodology into the very beginning of and throughout graduate level curriculum. Over the past decade, the declining mental health of graduate students following that of our population has been recognized. However, graduate students experience symptoms of stress, depression, and anxiety at higher rates than age and gender-matched populations. So the stress of our current society, the stress of finances, managing different responsibilities of their life, the increased need to work full-time, working with vulnerable populations, and launching into a career can result in things like disrupted sleep, substance misuse or abuse, declines in physical health, and poor academic performance and/or burnout. As you probably know and can see on this slide, there are innumerable ways to practice self-care, and these all contribute to living a balanced life. However, all of these parts can be overwhelming to already taxed graduate students. Motivation to care for self can be secondary and seen as another task that is overwhelming. In addition, as a clinical mental health counselor, we are empathic and we hear and see client stories of trauma and societal inequities. When these stories are compartmentalized and we go from one session to another without fully processing, the impact can lie beneath our awareness. I will say that considering all of these variables, facilitating self-care in the curriculum needs to be in part psychoeducation based, but it also needs to be creatively motivating to make sure it is utilized. And as we know, creativity can be fun and playful, which in itself is motivating. Creativity is how we explore, how we process, how we heal, and how we pay attention to all of the parts of life, including what lies just below the surface of our consciousness. This research started from seeing a need. This journey has led right back to the beginning of life, where we were, where we are, and where we all need to go. We learned early in life by playing. Playing is educational, it's motivating, explorative, and fun. As an introduction, let's briefly talk about the parts of this framework. Expressive arts therapies is a multimodal approach incorporating writing, drama, movement, art making, and music that has been studied in many settings. EAT, as I will refer to it as, accommodates various learning styles, as described by Gardner, due to using various sensory paths and practices to probe conscious and unconscious thoughts, behaviors, and emotions. The life enrichment model, like the expressive therapies continuum, is based on the structure of the brain. Briefly, the LEM is applicable to self-care by instilling creative ways to strive for balance in life, both professionally and personally. And also the LEM aligns well with expressive arts therapies. Student-centered learning as a teaching method, in basic terms, is the lens used in the classroom that puts students at the center of their learning experience. It creates a classroom learning environment that is motivating, culturally inclusive, collaborative, and considers post-academic career needs. As mentioned briefly before, expressive arts therapies is a multimodal creative approach. Some of the guiding principles of EAT are that all people have an innate ability to create. The creative process itself has healing potential. Feelings, emotions, sensations, these all can lead to a source of energy. And it is a whole brain, whole body experience, and that enriches wholeness. Expressive arts therapy honor process is primary, including creation, image as a marker along the path. And as mentioned, it's a multiple sensory pathway that is reached through expressive arts therapy. And this is a greater potential for processing and also for motivating. In other words, it leads to access, release, and transform. The goal of the life enrichment model is to live an enriched life and to understand how an enriched life can help a clinician maintain a sense of well-being. As stated in Lisa Hines' book on the subject, living an enriched life helps people achieve robust physical health, supportive social relationships, and meaningful professional work and life. The model presents 3 essential pieces to an enriched life: a deep well, wide margins, and firm boundaries. A deep well of enrichment comes from various aspects of the LEM, but especially from increasing positive emotions like hope, optimism, resiliency, and self-efficacy. To have wide margins is to have time built in the day for a pause. Sometimes this pause is for rest or relaxation, and sometimes it's for self-reflection, but it is always necessary to carve out time between activities to live mindfully, to just be. To embrace firm personal boundaries, one must realize that it is not selfish to focus on one's own life and health, but is actually a form of necessary self-preservation. When you live an enriched life, you can preserve your health and have more energy to give to others. There is much more to these 3 foundations of the LEM, and I encourage you to read the book listed in the references if you have not already. The notion of teacher's facilitator has become synonymous with student-centered learning. Expressive arts therapy fits well within this type of facilitator and student-based learning environment, as expressive arts therapy is multimodal and participant and/or group process and incorporates a student's learning style while providing multiple pathways for exploration of the conscious and unconscious through accessing, releasing, and transforming. This slide provides a few examples of student-centered learning activities to consider. Self-care and wellness practices are important in counseling education curriculum. As educators, we are called to teach and model these practices for counselors in training. Introducing the role of EAT and LEM in a student-centered learning environment can occur in an Intro to Counseling class and be reinforced in subsequent classes via the student-centered learning model. A personal expressive arts therapy-based visual journaling practice can be instilled in this first class and encouraged to occur 2 to 3 times a week on their own. Specific curriculum ideas to promote a self-care wellness education will be described in the following classes. We'll look at Intro to Counseling, theories, cultural and social diversity, human growth and development, career development, and practicum and internship. EAT and visual journaling can be introduced in the Introduction to Counseling class, and a bi-weekly practice can be encouraged. Emphasis is placed on co-learning, where the process is done by experiencing within the class and taking away a version of the practice that works for your cultural identity. Some of the check-in steps for visual journaling can be setting an intention, developing a body-centered awareness, allowing inner imagery to form, and expressing that inner imagery through drawing, painting, moving, creating, sound making, to honor the inner wisdom of the imagination through writing. This slide is included to provide you with an idea of how a visual journal can be used to visualize via image and described by writing. It can start with an intention. Is it possible to do all I need to do and still play, as shown in the imagery on the left? Or I hold anxieties in my shoulder, but what lies beneath, in the example on the right? The next 2 slides provide basic ideas for assignments to introduce into a student-centered learning environment for student input. So in Intro to Counseling, individual written reflections on their current self-care practice can happen with ideas for the future after participating in a service learning experience through this class. Introducing group expressive arts therapy, including visual journaling, which will be continued as an individual 2 to 3 day a week practice throughout the program. And also you can have a group project to build cohesion within the cohort, so exploring ethics and how to do this through establishing a self-care wellness practice. In the cultural and social diversity class, You can identify culturally congruent coping strategies to promote wellness by interviewing a culture different than one's own. And then in the human growth and development class, there can be a group project to reflect on methods for self-care practice, ideas for various life stages to help maintain resilience and wellness. And these are all just ideas because you definitely, within the student-centered learning model, you want to get student input on what these will exactly look like. Some other examples within student-centered alignments to promote the self-care wellness curriculum include within career development, it could be students working with clients to identify a self-care practice to obtain and maintain balance in work and home life that is culturally appropriate. In a theories class, students could present individually on how their personal theoretical orientation can be used to promote self-care and wellness practice with future clients. In the clinical part of the program and practicum, students revisit their self-care wellness plans to accommodate new clinical stressors. At the end of the semester, this plan can be revised as needed to strengthen any identified areas of weakness. They can go back to where they started. There can be group expressive arts therapy opportunities to process clinical experiences and balance personal and professional aspects of life. And then an internship, where there can be a large amount of stress. We continue the group expressive arts therapy opportunities to process clinical experience and strive for balance to maintain that in the professional aspects of life. I've also done a class book club where Heinz's The Life Enrichment Model, A Pathway to Optimal Health, has been read by the students in the class, and they work on the art therapy experientials at the end of each chapter together and process the content of the book. So what I provided in the last couple slides, it's just touching the tip of the iceberg of what can be done when introducing creativity through expressive arts therapy to promote a self-care practice. But in conclusion, the practice of honoring the sacred self to best serve others involves engaging with the moment through our senses to experience what is just below the surface of awareness that needs to be released and transformed. Being present with ourselves and others, gained through a self-care practice, helps provide a balanced perspective of responsibility and play, leading to a thriving existence. Thank you so much for your time and attention, and included is a partial list of references.